A topic everyone in Hollywood still seems to be talking about is Ozempic. The medication that has previously only been prescribed to people with diabetes has taken Hollywood by storm.
Imagine popping a pill that doesn't just melt fat. It rewires your brain, so pizza whispers to you instead of screams at you, begging you to eat it. Celebrities swear by it, doctors are prescribing it, and big pharma's drooling over an estimated $100 billion in revenue and sales. But is Ozempic a miracle or just messing with your hunger forever? Today, we're going to break down the honest, evidence-based science behind GLP-1 medications, including what they do well and what we still don't know. Hi everyone, my name is Dr. Amy, and on this channel we break down medical science, complex research, and common health myths, all in simple language without the medical jargon and the confusion behind it. The goal is simple: to help you better understand your body, your health, and the science behind medicine, so you can make smarter health decisions and improve long-term longevity. Quick disclaimer, this content is educational, and if you have health concerns, always consult your physician for personalized medical advice. So, before we dive into the fascinating and somewhat controversial world of drugs like Ozempic, Wegovy, Mounjaro, we first need to understand what these medications actually are. Interestingly, GLP-1 drugs have been around much longer than what most people think. The first drug in this class, exenatide, was approved by the FDA back in 2005, so almost 21 years ago. So these medications are not exactly new, but their recent popularity is unprecedented. The story actually begins with a natural hormone in our bodies called GLP-1, or glucagon-like peptide 1. This hormone is produced primarily in cells of the small intestine and to a lesser extent in the pancreas, the neurons, and the brain. GLP-1 belongs to a group of hormones called incretins. And you obviously don't need to know what an incretin is unless you're an endocrinologist or a doctor, but they're just a group of hormones that are released after we eat. They have different functions in the body. So these incretins, and specifically GLP-1, are released after we eat, and they play several important roles in our metabolism. They help stimulate insulin release, reduce glucagon production, they slow gastric emptying, and increase feelings of fullness. In simple terms, GLP-1 acts like a metabolic signal that tells your body, food has arrived, let's process it efficiently. GLP-1 agonist medications essentially mimic this natural hormone, binding to GLP-1 receptors throughout the body. As a result, they increase insulin secretion when glucose levels are high, slow the emptying of the stomach, and signal the brain to reduce hunger, which is why these medications were originally developed to treat type 2 diabetes. But something interesting happened once doctors started using them on these diabetic patients. Patients started losing a lot of weight, and not just a few pounds. In some cases, 15, 20, and even 25% of body weight. That's basically people losing a fourth of their entire body weight. For decades, especially in the West, obesity treatments were extremely limited. Lifestyle changes alone often failed long-term. Older medications we had produced a very modest weight loss. It wasn't enticing for people to go on them. And the most effective intervention was bariatric surgery, which is invasive, not appropriate for everyone. You need to be on vitamin supplements for a few years after that. It could lead to a lot of complications. So it's not really the most convenient option, is it, if you want to lose weight for someone who is severely obese? Then suddenly, these medications appeared, these GLP-1s, and the results were dramatic. It's honestly, I think, the most excitement I've seen around a medication since Prozac in the late 1990s. Remember when everybody had to be on a Prozac, SSRI, and it was like the miracle drug? I feel like Ozempic is having its shine right now, and the results are very visible. So what does the actual research say? Large clinical trials and meta-analysis examining dozens of randomized control studies have confirmed something remarkable. Medications like semaglutide and tirzepatide can lead to up to 15 to 25% body weight loss in many patients with obesity. To put that into perspective, that level of weight loss was previously only seen with surgery, or mostly, unless you were one of those very rare individuals who was able to work out and lose 100 pounds, but those are very rare. Most people had to get bariatric surgery in order to see significant result and improve their health. The most dramatic results in these studies were observed in younger patients, women, and individuals with a higher starting BMI. Of course, because the higher weight you start at, the more you're able to lose the weight quickly because there's an excess of it. One of the newer drugs, tirzepatide, showed roughly 20% average weight loss in about 36 weeks in some studies. Earlier GLP-1 drugs like semaglutide produced around the same amount of weight loss, 15 to 20%, but over 68 weeks, so double the time. But tirzepatide, the new generation, seems to be very powerful and much more efficient. But there's an important detail that many people overlook. Most of these studies measure body weight, not specifically body fat, which means we don't always know how much of that lost weight represents fat, water, muscle mass. And of course, muscle mass is important because maintaining muscle plays a critical role in metabolic health and long-term longevity. Evidence suggests that some muscle loss occurs with most forms of rapid weight loss, including your GLP-1 medications. Like all medications, GLP-1 drugs are obviously not going to be appropriate for everyone. They should generally be avoided in people with a personal history or family history of medullary thyroid carcinoma, so a form of thyroid cancer, certain rare endocrine tumor syndromes such as multiple endocrine neoplasia type 2 or MEN2. And one of the reasons that doctors and scientists are cautious about the rapid rise of GLP-1 drugs is that the long-term data is still very limited. We haven't studied these drugs for a considerable amount of time, especially the newer generations. Most of the available clinical trials follow patients for about 3 to 5 years. In medicine, that's a very short time, relatively speaking. Many drugs that we consider extremely safe today, like, I don't know, blood pressure medication, statins, heart medication, they've had decades and decades and decades longs of safety data and studies. So now let's talk a little bit about the side effects, right? The most common side effects of GLP-1 drugs so far have been gastrointestinal, and these include things like nausea, vomiting, diarrhea, constipation, abdominal discomfort, fatigue. And these symptoms usually occur early on in the treatment, and they tend to resolve over time. So they improve as time goes on. The body gets used to it. More serious complications have occurred, but they are rare. One of the most important serious complications that we have data on is people have developed pancreatitis, so an inflamed pancreas, which could be fatal unless you go to the emergency ASAP and get it treated. People have had severe hypoglycemia, so severe low blood sugar levels to the point where people were actually symptomatic. They were sweating, tremors, shaking, confusion, and even ended up in a coma. And some potential concerns around anesthesia and surgery, because GLP-1 medications also are known to slow stomach emptying, called gastric emptying. Patients may still have food in their stomach even after fasting. This can increase the risk of regurgitation or aspiration during anesthesia. And trust me, no anesthesiologist wants to deal with a regurgitation case. For that reason, the American Society of Anesthesiologists recommends temporarily stopping GLP-1 medications before certain invasive procedures where you'll be put under. There are also some emerging areas scientists were watching closely, speaking of side effects. Animal studies showed that thyroid C-cell tumors in rodents have occurred in combination with use of GLP-1 medications. There also have been some rare reports of conditions called non-arthritic anterior ischemic optic neuropathy, or NION, which affects the optic nerve, so the vision. However, research is still ongoing on to determine whether this is a direct causal relationship with GLP-1s or a confounding factor or just a coincidence. So the evidence is not very strong yet. Another important issue has been weight regain. After stopping the medication, some studies suggest patients may regain up to 2/3 of the weight they lost within a year after discontinuation, which raises the important questions about the long-term sustainability of GLP-1 drugs. In my opinion, GLP-1 medications have truly revolutionized the treatment of metabolic diseases. I agree. They have changed the conversation around obesity, diabetes, insulin resistance, cardiovascular risk. As a doctor, I am eternally grateful that we have this medication now, and really I'm excited to see where it goes in the future. However, based on current evidence that we have today, these drugs are not well studied and they could lead to specific side effects long term that we still might not be aware of. So, that said, the metabolic improvements they produce, such as improved insulin sensitivity, lower blood pressure, can still lead to major long term health benefits, even if you don't lose that much weight. Muscle loss can be a concern, but this can often be reduced by adequate protein intake, resistance training, and making sure that you keep the body active while you're on this medication. Revolutionary? Absolutely. Ozempic is more like a wingman for weight loss, not a fairy godmother who transforms your biggest wishes into reality instantaneously. You still need to exercise and prioritize protein intake to have great results and maintain those results. For the right patient, I have prescribed these drugs, Ozempics, and I hope that it has improved their life and improved their health. Me personally, I don't need it. I wouldn't use it. Me, my treadmill, and my fridge, we have a pact that we're in this together. But of course, if I was severely obese, overweight, I agree. I would be extremely tempted as well to use it because they seem like they are the new miracle drug for weight loss. But they should be also taken with a grain of salt. If you enjoy evidence-based medical content explained clearly, consider subscribing. And I'm curious, would you consider using a GLP-1 medication for weight loss? And what is your BMI? Let me know in the comments down below. I would love to hear more from you guys. And I'll see you on the next video.